quite low when we compare OD and Zaki Biam. So it means that probably the military are getting more professional, or I don't know, because they did wars. And I think when the governor was there,
but the reports are still coming. This is just the beginning.
Yeah, it's what the community has said now. I saw the picture of the governor in the community. I saw a building standing. I was like, at least something is standing. I saw a church, I think. Church standing over there. They still left one because, in time past, they were brutal, worse than this. But that does not mean that what they have done, it should be forgivable. Or forgiven. I think the people can sue. The community can sue as long as they are investigating everything. The community can also sue because you cannot now say, you cannot just kill people extrajudicially and say these people, because they were present there, they might be innocent.
They're innocent
there might be people who don't know
guilty.
anything, and so it's wrong.
And even when they are guilty,
even if they are guilty, they deserve their day in court.
Right?
Yeah, they deserve their day in court to be proved the guilty. So the issue here is that it is quite unfortunate, and whatever needs to be done by the government, the state government, to ensure that that matter is properly investigated and those found capable are put, made to pay the price, whether military or civilians, they should do it. Right. People should not just die because they are in a place at the wrong time.
Yes. Right, thank you so much. I must appreciate you for coming this beautiful Monday and giving it. Okay, I think I just got signal from my producer that we should continue. Okay, let's do 10 minutes and then we're out of the conversation. All right, let's look at this story from the Punch. Emefiele social programs, banks withhold 530 billion naira CBN funds. Cardoso may order refund. And Access Bank, GTB, FCMB, 6 others keep unused funds. SMEs seek fresh loans. NFIU, NASAL to tackle anchor borrowers, loan defaulters. CBN rules out interventions. A lot of rider.
You see, the central bank under Emefiele was a mess. The bank left his core duty of being the banker's bank. And started becoming both microfinance bank, loan app. It became everything. Because, see, that's why you're having this issue. And that's why we are where we are, badly.
Yeah.
He invested so much money on anchor borrowers, which till this day, a lot of people have not paid. There are a lot of people on the streets who just get alert. They are picking up their money from their banks now. Because that's what's happening now. Because when they took those loans, they thought it was, somebody told me he thought it was a grant. I said, okay, why would they give you a grant and not give me a grant? Because what makes one person qualified for a grant and the other person not qualified? Because these things have different ways for which people are qualified for it. Emefiele was just doing things without following the proper guidelines for which CBN was established. Now we have so much money tied in banks because these were monies that were meant to be disbursed again for maybe for farmers or whatever. I remember when he was governor, the Minister of Agri then was saying, even if you are going to give monies to farmers, why don't you do it through the Ministry of Agriculture so that there will be synergy? Not that he was becoming everything, doing rice pyramid, doing everything. So I think somehow that administration messed up with the leverage they gave to Emefiele. But good enough, I like what Cardoso has said. Central bank will stick to its core function, which is being the banker's bank, monetary policies, while the Ministry of Finance will do its fiscal function. So that at the end of the day, two of them come together to make sure the economy improves. I remember when Emefiele was going to the Naira redesign, the Minister of Finance then told him, she wasn't even aware.
Wow.
She wasn't even aware. And he said he had gotten approval from the president. And the Minister of Finance didn't know. So you find that a lot of these things that were done in those times reek of corruption. There were a lot of undertones. People were doing things just to fleece the country. And we are here now. Thank God Cardoso is a bit level-headed. He knows what to do. If not, at a point, we're just walking on the knife's edge because the country was tilting over economically.
Wow.
So if you think of it, that money is just there in some banks. And yet we're talking of inflation and all the rest. So there are a lot of things that need to be done now to ensure that the economy moves at the right pace and, without, you know, hindering the common man on the street.
Right.
Because all these things at the end of the day affect the common man. Because at the end of the day, this money you are seeing run around the top banks, the top people. They make, every time you see them putting huge profits. And meanwhile, the economy doesn't show anything
Economy
to
is
people.
suffering.
So how do you make profits when everything around is is making loss?
We're not feeling the impact.
You're not feeling the impact of your profits.
At all.
So the central bank for now should do what central bank should do and allow others do what they should do.
And be central for once. All right, moving on. Kwara shuts abattoir to probe poisonous meat allegation. I heard that over, I can't remember the number now, I read it in the news, but it was a big one. Cows, poison, and they found out that they were just dying. So they suspected that someone or somebody or some persons,
Might just be a disease.
I don't know, maybe it's
disease.
this disease that happens to, we don't know the disease that happens to
It could
cow,
be, it could
but
be.
maybe
It
they
could be
should find
anything.
out. It could be anything. But
Because
no,
it's not easy for somebody to just be poisoning cows around.
right.
So it might be
I
something.
don't know, anything can happen. But the news about it now is that they are afraid. They are going to, they slaughter, instead of them to dispose of the cows, they slaughter them and we're ready to, of course in the abattoir, to sell them to
Because they don't want to make loss.
to buyers. And people will buy and consume. And tomorrow they say you have cancer of the this, cancer of the that. A lot of things are happening. Now the question is, do we have people who are stationed at the abattoirs because this is like an eye-opener for us. See, you are supposed to kill a cow. You take the cow to the abattoir, right? That's where they slaughter the cow, process it, and then distribute it accordingly for people to carry to various points to sell. Now, do you not think that we should have people who are assigned? These are their work. This is what they are paid to do. You're assigned to, every morning you wake up, that's your duty post. You go there and monitor the meat, the cow, whether it is goat or any meat at all, that they're going to slaughter in the abattoir. And then, of course, so that, making sure that it's safe for consumption.
But let's not talk for talking's sake, and let's look at the reality on the ground. Now, the Ministry of Agriculture, every Ministry of Agriculture has its veterinary department, or whatever name they choose to call it. And in Delta State, you have it also. And what is their duty? Their duty is to ensure things that relate to livestock, even your pets and all the rest, their health. Now, I grew up in Benin, where as big as Benin was bigger than, right from the time I grew up, it has always been bigger than Asaba. We only had one abattoir for long, until recently. All the abattoirs in Benin around the river, Benin, Boba River. And those days, you used to have health officials. Health officials. There are those from health, Ministry of Health, there are those from the Ministry of Agri, the veterinary department, all stationed there to check those things. But the interesting thing, I came to Asaba. Almost every corner, they are killing cows and selling. You have about 2 at Okpana Junction.
Abattoir or just slaughter
that
points?
anywhere you kill meats is an abattoir. Anywhere you do.
Or is it an
But
official abattoir?
that's what I'm trying to point out to you now. You have these ones. I don't know what the Ministry of Agriculture, because now we are talking of the case of Kwara.
Yeah.
I'm bringing it down home so that
Of course.
you wake up. Now there's one around, whether near Bangida, I know there are 2 around Okpanam Junction. I heard now that there's one around Okpanam Road here, close to head of service Cabinet Road. Now you have the normal one we know. There's one at Cable Point. That's the real abattoir I know.
Yeah.
That is the official one. Now my question is this, because I have seen, I think I've been to 1, 2 of them. I've never seen any official of the Ministry of Health, Ministry or Department of Veterinary, whatever they call it, from the Ministry of Agriculture. The question is this: if what we are saying is happening in Kwara now happens here in Asaba, because this is Asaba alone.
Yeah.
I'm not talking of Warri.
Yeah.
I'm not talking of Saple. I'm not talking of Agbo, where if you go to Agbo, you see donkeys, because yes, they kill donkeys in Agbo. Good. I'm not saying people should not eat donkey. I don't know.
Jackie meat.
Good. I see it in Agbo, because when driving through around, you see the donkeys there. Now, my question is this: what have we done to ensure that, because that is how, that's why you have all these departments, not that they sit in the office and begin to answer big names.
But they sit there.
But what are they doing? What is the regulatory body? Because you have to, who gave them licenses to be killing cows everywhere? Do they have the necessary equipment to kill these cows in a hygienic manner? Do they even have water, simple water to wash? Because that's why the ones in Benin were located by the river there, so that they can, that's, if you go to Benin, you see it by the river there. So what do, and I think that's one reason why the one at Cable Point too is
Because
located
it's
that
close
way.
to the
So
river.
I just ask myself, what are we doing to ensure that the lives of people in Delta State, because I'm just giving Asaba, if it's not what happening in Asaba, you know it will be worse in Agbo, it will be worse in Wari,
Supposed
Saple,
to be
Uheli.
state capital.
Of course. So these are the, that's why I said we shouldn't just talk for talking's sake, because if the government listens, these are the things you have to be proactive about. Because one day, you see, there are diseases these animals can have, and we're talking of cows. What of poultry that sell
Oh my
frozen
gosh.
chicken? A lot of these frozen chickens people buy are chickens, probably some of them have died from diseases. Who confirms that they're okay?
All right, you're welcome back to the studio. And earlier we were talking about the safety in our abattoirs. And Anita here was opening my eyes to see that. See, we don't, in fact, in the States, you might even have one. And that one, because we were talking earlier about maintenance culture. I think it was off the camera. Because I know that we have one official abattoir in Asaba. And then you notice that they have so many places, other places that they slaughter cow. Let me assume maybe the demand is high, maybe the abattoir is not enough. But then, how clean, how hygienic is that place? How, because it's not enough to just slaughter meat and then sell. And sometimes, even though you try to wash with your salt, try to even boil
And
water.
who certified them to
Who
sell?
certified them? The cow. First of all, before you slaughter that cow, there's somebody to certify
That this guy is healthy enough for human consumption.
Healthy enough. But in a situation where the people are being paid salary monthly, and you don't even go down, you see, they take up that responsibility. I've been employed to go to abattoir. I'm a civil servant, and at the end of the day, end of the month, you receive salary. You see, the sins and the judgment that God will have to judge on that final day is just too much. Because the truth is, our safety is questioned here. If we don't have people who are stationed in those places where they slaughter cows, goats, not just cows, even chicken should also be part of it. Yeah, and they certify them okay for consumption. That's what we want to know, because we can't travel that. Even when you go to the abattoir, you will not know that this cow is not, it has been long dead before they even came there. So I mean, our government, in fact, I don't want to place it on the government
there
alone.
are a lot of things we do that are, we do them. I think it is normal. Do you know, even if you buy eggs, I'll give you an example.
Okay.
Do you know eggs have expiry dates?
Hell,
No, they do. They do. It's just that
I just know that
because-
when I crack my egg and it has maybe smelling bad, has some
eggs have
other,
expiry
then it has
dates.
expired.
They do. But because of the systems we operate here, we just feel that once the thing gets out, anybody is food. A lot of things. If you go to big shops, I'm sorry to say,
Yeah,
not
yeah.
advertising shop. If you look at real big shops, if you take the egg, you see it with expiring dates,
Yes,
the dates of
Yes.
the date of expiry.
yes.
Now, but that is for eggs. Now, do you know sometimes at the market people sell meats that they didn't sell, they
They
didn't
put it in
finish,
the fridge.
they'll sell it the next day.
Yes.
So there are a lot of things that, we are just lucky we are living in this kind of environment because there are so many diseases that Nigerians can die of easily. And people might be dying of it and you just think it's brief illness. Because
Or the
what should
village
be
people
done,
has, come.
the regulatory bodies are not doing what they should do. I don't see why abattoirs will just be springing up everywhere. And I have never seen an official one of the Ministry of Agric,
Me
the veterinary
too.
department
Me too.
there. I've never seen.
Me too.
It's wrong. And you see them, the worst thing, they now use tires to roast the meat.
Yeah.
Tires. Nobody asks about the chemical component of those tires that's using to burn those meats. And you see people buying pomo, sitting in the sweet pass. People are eating. It is, I don't know how to put it.
Oh my God.
I think our institutions are vicariously liable of killing Nigerians too. Because if the Ministry of Agri cannot do that, I'm speaking for Delta State now, do those simple things to put personnel to ensure that what is right is
So
done.
tire is not even ideal.
It is not ideal.
So what should be? Firewood?
I don't know whatever you want to use, but not tire. It is a recent development. When we were kids, they don't use tires to burn even goats.
They use firewood now.
Yeah, but nowadays, what all the chemicals that are involved in the thing, I don't know.
There are some that don't even burn. I don't know
And
what they
funny
insert.
enough-
Oh my gosh.
No, do you know these things we do here? If you go to places like Kano, that animal that is being burnt, they kill, they skin it.
The skin.
That's what is the leather that you use to make your belts and all the rest. So it's another ball game entirely. But here, I'm not saying they shouldn't roast whatever they want to roast, but I'm asking, is tire ideal? Tire ideal to roast goats or cow?
This is supposed to be a hot topic conversation, and I mean, we're going to talk about.
You guys should
it-
invite the
it's-
Commissioner
it's-
of Agri.
It's going to be a hot topic conversation actually, because I mean, nothing is even safe anymore. You buy fruits, you don't know how they're processed. A lot of things going wrong, and it's an anomaly we need to correct as soon as possible. Thank you so much, Anita Giri. As
Thank you for
always, thank you for gracing our couch this morning. We'll take another quick break, and when we return, we do the concluding part of Morning Ride Mondays edition. Stay with us, we'll be right back. joining us this morning to talk about malaria management and prevention. We have Odua Joseph Unok. Okay, Unokiwedi. Wow. That's actually absolutely correct. I'll say that again. Odua Joseph Unokiwedi, a health and care officer, Nigerian Red Cross Society, Delta State. Welcome.
Thank you very much.
Let me start with Red Cross.
Cross.
Red.
Cross.
You ready?
Cross.
So we're talking about malaria management and prevention, and I know that April 25, that's this year, on Friday to precise, we're going to celebrate, rather mark the World Malaria Day, and it's actually very important, especially for a country like Nigeria that was still prone to malaria. What's it called? Is it a virus?
Disease.
Okay. Yeah. So, first off, I know you're not a doctor, but you are the care officer, health and care officer of the Nigeria Red Cross Society, Delta State branch. Now, could you tell us about the Red Cross Society of Nigeria's role in managing malaria in the country?
Okay, Nigerian Red Cross Society is an auxiliary to government, and as an auxiliary, we try to help our system to make sure that wherever there are any problems, any challenges, be it a disaster, be it health crisis, that we try to help the government to solve them. And so we have different departments, which the health and care department is one of them, saddled with the responsibility of intervening where there are health crises in Delta State. So as an auxiliary to government, we support the Ministry of Health in doing campaigns, basically in health challenges, and try to sensitize the people, more like identifying where there are gaps between the government and the people, and then bridging those gaps. So we do health sensitizations, like observing this World Malaria Day is one of them. We also try to engineer sanitation in communities, so that where there are mosquito breeding sites, we see how to destroy them and then make sure the environment is okay and safe for the people. And of course, we thank God for DBS. DBS has created a platform for the society to reach out to more members of the society. By that I mean members of the public, in doing media campaigns like we are doing right now. So we really appreciate that platform.
Okay. Now, how does the Red Cross Society of Nigeria contribute to malaria prevention efforts, especially in our local government areas,
Okay.
our local communities?
First of all, we engage in risk communication. We call it risk communication and community engagement.
Okay.
We do not just tell the people what the prevalence of mosquito bites and malaria are. We ensure that we make it a community program by involving the members of the community. And so when we tell them about malaria, we ensure that we have members of the community join us to do those sensitizations that we do. We mobilize them and see how to destroy mosquito breeding sites. And we also do distribution of nets and also the sharing of mosquito repellent creams, all targeted to ensure that we reduce the prevalence of mosquito bites and malaria.
And now that you mentioned mosquito repellent, just before I go to the next question, we know that all these repellents, sometimes it doesn't work, and even distributed to those communities, they're not sent. Sometimes they don't even know how to use it and why they should use it. And even the net, some don't feel very comfortable sleeping in a mosquito net, treated net. Now, because our communities, the country is prone to malaria disease, and they said that they had vision. They had vision 2020, eradicating was part of what they are supposed to eradicate until coronavirus came and made that vision impossible. Now they have also mapped out another, year of plans, and saying that they're going to, one of the things, because in US, for instance, they don't have anything called malaria there. It's like, if they hear malaria, it's like coronavirus to them. Do you see Nigeria, one day probably saying Nigeria is malaria free? Do you see it happening?
Okay. Before I get to this last question, I'd like to pay a little attention to the first line there.
Yeah.
Um, I don't think it's right to say that mosquito repellent creams don't actually work.
Okay.
The question is, what is the mode of application?
Oh.
And the mosquito repellent cream, is it still valid? Is it still active? Is it still potent? The big
Oh.
question mark there is, has it expired and you're still
Using it.
Because we know for sure that when you rub that cream,
Mm.
it generates some sort of chemotaxis that any mosquito that comes close to it will die.
Oh.
Yeah, that is for sure. So mosquito repellent creams are very potent, and when you use them, you are safe from mosquito bites, and that's why we make sure that where we have malaria cases, mosquito bites, that we use them. We distribute them to the people, and we tell them on how to use it. And by the way, it's safe for anybody to use, even
Safe?
children, yes,
Okay.
can use it.
Even
Adults
babies?
can use it, yes.
Mm.
So if you're the kind of person who loves to be outside late at night and then take fresh air maybe because you don't have light, you can rub the mosquito repellent cream and then
Okay.
just go outside. Let the mosquitoes come.
Mm.
You will see the results in the next month.
So which do you prefer? Spraying of the shuttles or those
I would
mosquito?
go for use of mosquito repellent cream
Oh.
because it's very safe. When you spray those insecticides,
Yeah.
you stand the risk of having your respiratory tract suffer some sort of difficulty while breathing. So
Right.
so I would definitely go for
Mm.
I would go for a mosquito repellent cream.
Okay.
So please remind me what's the
Yeah,
question
so
you
I'm
asked?
saying that you see us eradicating malaria.
Thank you. Yes. I think
Us, I mean Nigeria.
it needs to be pointed out that where you have the prevalence of malaria, by extension mosquito bites, is where you have low wash standard. When I say wash, I mean water, sanitation, and hygiene promotion, with particular attention to sanitation and hygiene promotion. The major thing that makes malaria endemic in Nigeria is because you have different types of mosquito breeding sites, and we encourage them by our activities. You see overgrown bushes, you see undisturbed stagnant waters. Mark the word there, undisturbed stagnant waters.
What do you mean by that?
That's okay. When you go to many communities now, you see the roads are not tarred, and then you see water logged in a particular place.
Right.
Cars don't pass through there, nothing passes through there, and then you see those waters, a lot of activities going on. By merely looking at it, you will notice it. So those are very good mosquito breeding sites. They love places where you have water and it's not disturbed, nobody goes there, and so they can just lay their eggs there and allow them to mature into adults, and then they go about doing the business. So when you have mosquito breeding sites like that, definitely they will keep coming back.
Okay, just
But-
before you run down, you run to that question again. Can you please highlight or tell us some of the mosquito breeding, what did you call it? Sites
Yes.
in our homes.
On
Let's
this-
start from the homes.
Undisturbed stagnant waters
Yeah.
close to homes.
Stagnant water.
Yes, undisturbed stagnant waters close to homes. Then you have containers, like it could be as small as a cup, it could be as small as a bottle, but as long as it is exposed, it's not covered, and water can go into it, majorly if it is through rainfall or maybe water finds its way into it by any means, even as small as a cork, a bottle cork, it is a breeding site for mosquito.
Ah,
Then you also have tanks that have water in them and they are not covered.
like the borehole tanks.
Borehole tanks that are exposed, they are mosquito breeding sites as well.
What
So-
about, okay, yeah.
So these places are places where you will find mosquito grow easily, undisturbed. And
Okay.
when you have them, of course, you're going to suffer mosquito bites.
So in our homes, sometimes, we have challenge with, we have epileptic power supply.
Yeah.
So sometimes, most homes, they have all these water,
Water tanks,
Tanks.
and wells.
I don't know.
Yeah.
Okay, yeah, wells
Yeah,
outside,
wells.
but in the house, in their homes, they have
Yes.
water tanks everywhere just to fill up water, pending when another light will come.
Yes.
So sometimes, are you saying that those can also be mosquito breeding?
Okay, I
Sites.
like where you're going. If it's the ones that are inside the house,
Right.
the propensity for it to be a breeding site is very slim because it's inside the house.
Oh.
But the ones that are the perfect mosquito breeding sites are the ones you find outside. The ones that the mosquitoes will easily just find their way to use up and then nobody disturbs them.
Okay.
Those are the ones that are the mosquito breeding sites.
Okay. All right, now some of the reasons why you think that eradicating mosquito.
So the day we take sanitation seriously, clear bushes, dislodge stagnant, undisturbed waters,
Water.
I trust you, mosquito will be bye-bye.
Bye bye in Nigeria. I can't wait because, but the another thing is that sometimes, especially Nigerians, there's this thing that every sickness is malaria. Once you're feeling dizzy, oh malaria. You're having headache, malaria. How can we disabuse our minds from that? That it's not all sicknesses we should term malaria.
Okay, I think I need to say this at this point. Malaria endemicity in Nigeria is very high. I think from the last NCDC WHO report that I saw in 2022, we have over 1.5 million cases of Nigeria yearly. That's like 27% of the total occurrence in the world. And mind you, by that 2022, I think the report that was given was we have 249 million cases worldwide. So imagine Nigeria having 1.5 million cases from that. And then that worldwide we have 608,000 deaths recorded
Wow.
from malaria. So you can begin to imagine how serious malaria is. And I think at the point it was started to be the number 2 killer disease in Africa.
Wow.
Malaria. So you would not
So which
blame
is
the
number
people-
one? AIDS, HIV, and AIDS?
I don't have that
I don't-
information right now,
okay,
but I
okay.
want to focus strictly
Okay.
on malaria.
Malaria, please do.
So you can begin to manage how the people will begin to feel when they know that malaria is a seriously occurring disease. So you wouldn't blame them when they begin to think everything is malaria. And then the signs and symptoms you have is also for other kinds of diseases. Basically the viral hemorrhagic fever diseases like Ebola, like yellow fever, Lassa fever, of course. So you wouldn't blame them. But then again, it needs to be pointed out that because of the symptoms of malaria, it's very easy for you to think it is while it is not. So we would actually beg the public, for any symptom that you feel, it is necessary for you to go to the nearest health facility. Get tested, get checked, and then you get treatment. Don't practice self-medication, because that's where you begin to feel that it is malaria. There are persons who are trained. We have doctors, we have nurses, we have pharmacists, basically clinicians. It is their job to test you and find out what health problem you're having, should you have any symptoms. So it is best for you to go to any health facility, get checked, and then get treated.
Get tested. So there is another one, just before I go to the main question. So there's this thing, I don't know who said that. I don't know whether it was, during the training that we had with you people. Someone said something about that the testing kits that we have, especially in our lab, that they are dated. Sometimes they say you have typhoid, and you don't really have typhoid, and that our laboratory, system should be, beefed up, because the kind of equipment that they use there are way outdated. They just churn out any kind of result, and then we take it hook, line, and sinker. What do you think? I mean,
Okay, I think we have
think that is
different
correct?
tiers of laboratory setup. We have tier 1, tier 2, tier 3. Majority of the ones that we see are not so top level, so well, but I cannot say for sure if the instruments are not.
Yeah, until you
I
see
cannot
them.
say.
yeah.
It's best you see them, assess them, and then you know the state they are in.
Mm.
But I know that many of the labs that we have in the country are labs that carry out tests regularly. So if the instruments that they use, the expendables that they use are frequently replaced because they use them.
Yeah.
So as long as they use them, it will be difficult for you to find that there is anyone that has expired, and then because
Yeah, okay, I
it will
remember now. The
affect
argument is
result.
that you cannot get a typhoid result. Sorry, I'm digressing. A typhoid result in a day. That was the argument. That is not possible. So, because we're talking about testing now.
Yes.
So you think that we can also get malaria result the same day? Now they have strip for it.
Yes, we have the RDTs, the rapid diagnostic test kits, so you
Yes.
can just test for malaria.
Just like you're
and
testing
in a
for
matter of
pregnancy.
minutes, you see the results.
Is
So
that accurate?
yes, it is accurate, very accurate.
Really?
Yes, I can attest to that.
Okay. Moving on, what are the key initiatives or programs implemented by the Red Cross Society of Nigeria to combat malaria?
Okay, first off, we carry out what is known as advocacy, where we meet stakeholders. By the way, Nigerian Red Cross Society is not the only organization that is saddled with the responsibility of responding to malaria outbreaks, extension and mosquito bites. So we have the WHO, we have the Ministry of Health, who is like a coordinating partner, coordinating every other agency. and so we all respond together in tandem with the communities, because we ensure that it's usually a community-led approach. So we make sure we carry the communities along. So we have advocacy meetings where we discuss with partners and then raise the concern and then map out plans to ensure that we respond and then keep the environment safe. We also have sensitizations. Thank God DBS is a partner with us where we reach out to people through the media. We also have house-to-house sensitizations, community meetings, focal group discussions where we raise the awareness for malaria interventions and how partners can come in to see that they support and then we get the desired result. We also have a distribution of mosquito-treated nets, distribution of mosquito-repellent creams, and then we tell the people how they can use these instruments to protect themselves against mosquito bites. Then we ensure that the community leads the intervention to dislodge mosquito breeding sites, because this is where we need to get it right. If we do all the sensitizations and we use the creams and the mosquito-treated nets, and we keep encouraging the breeding sites, it's going to be a loop. It's going to be a cycle. We keep helping them to come back. But if we find a way to effectively destroy those breeding sites and ensure that they don't come back, then we'll win the fight against malaria.
Okay. We're hoping and we're just being optimistic that we're going to win that fight. But in winning that fight, can you elaborate on the distribution process of the mosquito nets in malaria endemic areas?
Okay. Delta State is malaria endemic. Nigeria is malaria endemic. So that's why we have these activities going on. So basically, we try to collaborate with the state government. They have this routine malaria nets, treated nets distribution.
I want to also ask, sorry, how impactful is it?
It's quite impactful.
Really?
I remember one of the programs we had in 2019, and it was at Ole. So the states partnered with the Red Cross, and we distributed treated nets to students, to pregnant women, to children, and then to the aged. These were the priority groups because they are the most vulnerable people who get struck when malaria comes.
Right.
So we distributed the nets and we ensured that they got to understand the importance of using the nets. And we also tried to use mosquito treatment repellent creams. I think we did this when we had the yellow fever response in 2021.
Okay.
So of course, when you have malaria because of mosquito bites, there is every tendency you would also have yellow fever disease where you have the Aedes aegypti mosquito, which is the mosquito that delivers the yellow fever virus.
Yeah. Okay. So, how does the Red Cross Society of Nigeria support healthcare infrastructure to improve malaria management?
Okay. Basically, we assist with sensitizations. So we partner with them where they have their routine sensitization campaigns at communities. We join them. By the way, the Red Cross has a network that covers the nooks and crannies of the state, and it's the same for other states as well. So wherever we have the agency in the local government, we have our units partner with them, and then they help to sensitize the communities. And you know that Red Cross volunteers are members who are community-based. So they are members of the community. So when they partner with the agency, you definitely understand that the mode of uptake, the rate at which people accept the message is faster because they are members of the community. Imagine when you have an outsider come to tell you that you need to use a mosquito repellent cream, and they begin to think, does this thing work? Is it effective? But when they have one of their own, their sons, their daughters,
who uses it?
propagating the message to them, telling them how to use it, telling them the importance of using those creams and how to use those nets, bet me, they would easily and readily accept the message. And we are hoping that it will have some sort of engineering a behavioral change pattern within the communities, because that's what we've been working at and we've been getting the results. And like social behavior change is not something you get in one day.
Right.
It is a continuous process. You'd have to keep drumming the message and hope that the people take the initiative and then change.
Right. Now, in what ways, following what you just said now, in what ways do you think individuals or communities can get involved with the Red Cross Society of Nigeria in actually combating malaria scourge?
Yes, I think the one challenge that we are facing is the availability of mosquito-treated nets. and mosquito repellent creams. Every other one we can easily get done by mobilizing the people to clear the bushes, to the sludge waters, and we sensitize them. But we need lots of mosquito treated nets. We need the antibiotics, of course, we can get them at the hospital where they are used to treat people. But basically, those nets are the repellent creams because the people need to use them. The hospitals will not always be there to give them the drugs, but where they have the treated nets and where they have the repellent creams, they can easily use them and may not even have the need to come to the hospital to get treatment. So we
Oh.
need partners to come and support. We need a lot of support. We need the treated nets. If you cannot donate the cash, you can go buy them and then give them to us. And we would always make sure that we make that it gets to those persons who are most vulnerable, like the pregnant women, like the children, the aged, and then students. These are the priority groups that we want to ensure that they get these instruments, the treated nets, and then the mosquito repellent cream. So if you're out there and you're listening to us, you can reach out to us. Make sure you support us because what affects one person affects everybody. If the mosquito bites one person today, it can bite another person tomorrow.
So do you not think that the normal treated mosquito net are old-fashioned? I tell you what, for free. In my house, I have like two. I can't even. In fact, at a point, I started dashing it out to people because I find it really weird to put that.
Sleeping on that net.
I don't sleep on it comfortably.
It feels like you're being caged.
Exactly, and then the hurdles of me trying to fix it is a challenge, a big challenge to me. Now, but with the repellent, it's just like applying my normal body cream, even though you are going to tell us how to apply it right now. Do you not think that they should do more of the mosquito repellent or any other thing that can repel mosquito other than, play down on the mosquito net? Because I feel like it's old-fashioned. That's my thought.
As you can see, I'm trying to sit up because I'm
Please
most
sit up.
interested in this. The day we take seriously to sanitation and hygiene promotion, like I said before, then we would easily do away with mosquito treated nets and repellent creams. Right now, the best shot we have at managing mosquito bites and keeping malaria at bay is using those mosquito treated nets and repellent creams.
Okay.
We've had a lot of complaints from people who we give those mosquito nets to and the creams. The ones who use the nets say they feel like they are being caged, they are not free, they are not comfortable, they have complaints. But where you do not have any other alternative, you would have to make do with what you have. Unless, of course, you want the malaria to come at you and the family, which is not advised. So, mosquito-treated nets and the repellent creams, they are very necessary at this point.
Can you use both of them together?
Where you use one, do not use the other one.
The
It's
other
really
one.
not necessary.
Not necessary.
Yeah. So if you sleep under the nets, don't bother about the cream.
Using
But
the-
if you have the cream, it's fine. You can rub the cream and then you can go to sleep. Rest
Without
assured,
net.
there won't be any mosquito bites. I think the only thing you would have to worry yourself about is heat because we're in a very hot period now.
Very hot.
So a lot of persons will not find it very comfortable using that
Not
mosquito mosquito repellent cream.
Okay.
But it should not stop you because our people say when you have two demons, you'd have to choose one. I think the use of mosquito creams, repellent creams, and the treated nets is a lesser demon to the mosquito bite. So
Right.
I'll go with that one.
Okay, now, we're in Nasaba, for instance, and we know that there are some people who, so there's this thing that they told us before, I don't know if it's a myth or a fact, that when your AC is on, right, you're sleeping in an AC compacted room, that you don't have any business with mosquitoes. Is that true? Is it a myth or a fact?
Yeah, that's a very interesting question.
Yeah.
I'm going to share an experience I have with you.
Okay.
So I went for a program, and it was one of the communities at Ndukwa. So the room I was in, we had fan and we had AC. So I opted to use the AC, and I was warned to close my window on time because of the nets, because of
Mosquitoes.
even though they had the nets at the windows.
Yeah.
So I had to do that, but I woke up around 12 a.m. and I was hearing the you know, the usual mosquito songs.
Oh,
By the way, it wasn't sonorous. It wasn't
of
pleasing at all.
course.
So I had to put on the AC because, of course, we have
Yeah.
this discussion severally that
mm.
it has a way of dazing the
Daisy,
mosquitoes.
yeah.
And so when I put it on, I didn't hear any sound of any mosquito coming near me, and I didn't suffer any bite.
That's a fact. Then.
So,
It's
I
a
mean,
fact.
the rest is for
I
you
mean,
to
you are,
deduce.
you have a testimony.
Yeah, and by
It's
the
an
way,
evidence.
and by the way, the fan also has the same effect.
The fan can make it scamper
Yeah,
for
and
safety,
then not come to
but
you.
then, yeah. So that's, so I'm driving somewhere. It means that people staying in GRA area, for instance, now all our politicians, the wealthy, the bourgeois that stays in a very comfortable environment where you can go a mile without seeing, bush or anything, or even all those kind of what did you call it? Things
The
that
breeding sites.
the breeding sites. So it means that they may not suffer, the malaria scourge that we're suffering.
Yes, as a matter of fact, you would get bitten by mosquito if there is a breeding site close to
Okay.
you.
Okay.
Mosquitoes are not known to leave the breeding site and then go far distances just because they are looking for food. The food they are looking for in places where it cannot support their existence is
Right.
close to them where the breeding sites are. So they will always be at those places where you have the breeding sites. Of course, the food can go around very easily. Very good rations as well. You will never exhaust the food. So it's very rare for you to have mosquito bites in places where you do not have the breeding site, because they would need to reproduce and continue the cycle.
Well explained. Okay, let's take on this question. What are the challenges faced by you, the Red Cross Society of Nigeria, especially Asaba, Delta State branch, in malaria management, and how is it being addressed now? How are they being addressed?
Okay, one of the challenges that we face are anthropologic activities. When I mean anthropologic activities, I mean human activities.
Okay.
Those activities that favors, that encourages the mosquito breeding sites, and that's why we keep coming back, preaching the same message, keep encouraging people to ensure that they do not encourage those breeding sites. And then also, most persons do not get to understand how to use the mosquito repellent creams.
Okay.
By the way, it's very easy to use. Some persons, when you give it to them, they take it, but they go and keep it at home. They don't use it. They only remember to use it maybe when it has expired, because it has an expiry period.
Yes, it has.
So when we give you these items, please ensure you use them. Anybody can use them. All you need to do is, after taking your bath, like in the night when you want to go to bed, just rub them. Rub them on places where you know are exposed, like the places where your clothes don't cover. Like the way I am now, my
Yeah.
arm like this. Those are the
Yeah.
places where the mosquito would easily have access to. So rub them on your arm, on your legs, and your face, and then go to bed. Then if you're the type that doesn't like to put on clothes when you
You
want
go
to
to bed naked,
rub it all through,
everyone.
and you're good.
So those are the challenges.
So that's one of the challenges.
Okay,
And
one.
then we also have the challenges of the availability of mosquito treated nets.
Okay.
They are always not enough, and that's how we prioritize a particular category, those persons who are most vulnerable. So if it is enough, of course we would like to give it to everybody. So we have a problem of the availability of mosquito treated nets, then funding. So that's why we need partners to come on board and see how to support. If it's cash you have, it's fine. If it's the mosquito treated nets you have, it's fine. But we need them.
Okay. So tell us your success stories, what successes has the Red Cross Society of Nigeria achieved in the fight against malaria, and what are your future plans? No, let's leave future plans first. Let's talk about your successes, your success stories so far.
Okay.
Stories. Yeah.
Year in, year out, we have our sensitization campaigns going on. We tell the people about the prevalence of mosquitoes and malarias in the communities and how they need to combat it, and also social behavior change. Now, this one came in last week. Some people from the community in Oko had to call and ask us at Red Cross, how are they? And I still get mosquito net. We need mosquito net. It tells you that they are growing to the awareness of using the mosquito nets, and they are looking forward to us bringing it to them. So that in itself is a success story.
Okay.
Because if they don't have that awareness, it tells you that we're already engineering the social behavioral change I talked about.
Right.
So that in itself is a success. Then we have carried out an on-site assessment at a camp called the Board Camp between Akukwimbu and Ubulu, where we did some sensitizations, and then we encouraged the pregnant women to ensure that they go to hospital, like seek ANC because of the prevalence of mosquito bites there. And when we went back there, a good number of the women gave us a good report that they took measures to ensure that they went to hospitals and they clean up the environment, and also they use the nets that we give to them too.
Okay,
So
they
that
use
is another success story.
So,
Now, no matter how small these success stories are, we know that over time, with our continued programs, that these success stories will grow into wildfire and it will spread. And that is why we will not get tired of doing our sensitizations, mobilizing the communities, because we know that if we intensify our efforts, that the reports will keep coming in.
okay. So you've not received call and saying, please come, we've booked one hotel for you to relax, for a job well done.
We are hoping it will come.
That's an enlightening note. Let's talk about the World Malaria Day that's built to be observed on April 25. That's on Thursday.
Yes, it is.
This week, and the theme is accelerating the fight against malaria for a more equitable world. All right. So, what are your plans now? That brings me to your future plans. First of all, let's start with this
Yes.
observance. What are your plans, the Red Cross Society?
About that, I'm going to use a legal term, a legal maxim that says res ipsa loquitur, means the facts speaks for themselves.
Okay.
We are actually making plans to ensure that we do the routine practice, sensitize the people, mobilize the people, and the news is going to be coming on air. We're not working alone, we're working with other agencies, the WHO, the Ministry of Health,
UNICEF.
UNICEF too, Primary Healthcare Development Agency. We're going to be making sure that we hit the nooks and crannies of the state. It is not just going to be an Asaba thing. We are hoping that all the local governments will key into this project. And we are making good plans to ensure that we get this done. So just stay tuned, listeners. And by the time you see us, please join our road shows. We're going to be having road shows.
Okay.
Join us and create awareness for malaria. The news is not just for those who are listening, for your family members or friends and colleagues. Ensure you sensitize them. It is for everybody to keen and then make sure that we fight malaria and kick out malaria from our community.
Right. So in that, observing that day, or rather, yes, celebrating that particular day, do we see the Red Cross Society and other partners distribute items such as mosquito-treated net, repellent, and the likes?
Yes, we're going to be doing that, and like I said, we're going to be focusing on the priority
Is it
groups.
on the road walk?
Yes,
During
on
the road walk,
we're
rather?
also going to be having designated centers where we'll do the distribution.
Okay.
It will be coming out very soon.
Strictly
The
for
plans
that
are
day.
already, yes, the plans are already on ground. But we'll be focusing solely on those persons who are most vulnerable. Why? Because we do not have enough supplies.
Right.
So that's how it's going to play
So how do you know the people who are most vulnerable?
Yeah, pregnant women are most vulnerable
Okay.
because they are, well, it affects them and it also affects the baby they're carrying. Then we have children because, see, from reports, children from 5 years and below are the most affected category of people who suffer from malaria.
Oh.
Yes, and a good number
Why?
of deaths.
Why is that?
Because they are very susceptible to malaria bites.
They can't. Is
to
it that they
mosquito
can't?
bites.
Okay, susceptible. Like,
Yes,
is
they
their
are, they are
skin
more
more?
susceptible.
Is their skin more sweeter for the malaria?
Their resistance to malaria is
Oh,
not as strong
resistance.
as those for adults.
Okay.
And adults are readily going to take measures to ensure that they protect themselves, while
That's
children
right.
cannot. They will depend on an adult, making them most vulnerable.
Vulnerable. That's right.
And then many of the deaths that have been recorded, over 80% of them are children who are 5 years and below.
And below.
So of course, like I said, res ipsa loquitur, the facts will always speak for themselves.
Okay, there's also something I heard. I don't know if it's a myth or the truth, that if a pregnant woman doesn't take her routine anti-malaria drugs, that she's going to give birth to a child who is having jaundice. Is that correct?
Very correct. and we do not hope for it to happen. Besides that, there is this situation where you have yellowing of the eyes. Okay, yes, that's the jaundice
That's
we're talking
jaundice.
about. Comes from breakdown of the proteins in the blood,
Okay.
releasing a substance known as bilirubin, causing that yellowing of the eyes, congenital malaria. That's the
Okay.
name. So
Okay.
you're very correct, and that's the reason why we target pregnant women,
Women.
most, because of that situation.
And it can lead to death
If not attended
if not
to.
attended to
Yeah.
properly. All right. As we wrap up, I need you to just leave a message for those watching, especially how we can be able to manage and prevent the malaria scourge
Okay.
in our communities and society at large.
For our listeners, our viewers, the fight against malaria is for every one of us. You need to key in. Do not sit on the fence. Join the fight against malaria. Clean up your compound. Clean up your environment. Dislodge all water bodies. Cover tanks that contain water. And ensure that you and your family sleep under mosquito-treated nets. If you have a repellent cream, a mosquito repellent cream, please do well to use it. But before you do, check if it's not expired before you do, because of course it's not going to be potent if it's expired.
So you promised to tell us how we're going to rub the repellent because I'm opting for that.
Yeah, it's very easy. Like I said before, after taking your bath, just rub it on your skin.
Just like the way you apply your
The way you
normal
apply your normal
body
cream,
cream.
just rub it all over your body. No side effects.
No side
In
effects.
case anybody's wondering, no side effects.
Okay,
You
but
can
it's
just
quite
rub it.
pricey.
No, it's quite cheap. It's not expensive.
It's not.
Yes, you can find it in a regular pharmacy.
Okay.
Yeah.
Are there particular brand? I know we cannot mention brands.
Yeah, we can't
name.
mention names,
Yeah.
but when you go to the
Apologies for that. Glitch. All right. So wrapping up, we've already advised us what to do and how to apply our repellent in case. So it means that if you cannot make use of the mosquito net, you buy a repellent. And I'm very glad you said it doesn't have what's it called
Side
now?
effects.
Side effect. And I think that's the best option I've seen or heard of so far. And I'm going to just, as soon as I leave here, arising from this conversation, I'm going to get my repellent and making sure until and I get to that stage where I don't need to bother about mosquito. That's when I go to the US. All right, thank you so much. We've been speaking with trainer Odua Joseph Unokiwede. Yes,
perfect.
he is a health and care officer, the Nigerian Red Cross Society Delta State branch, and we've been talking about malaria management and prevention. Thank you for coming,
It's been a
as
pleasure.
always. All right, that's it. It's a wrap from us, a Morning Ride Monday morning edition. On behalf of the crew, my name is Ife Osita Alunwa. See you tomorrow. Bye for now.